that joint sits. Do you guys get taught that there are two different articulating planes for the SI joint, but not anything detailed about it? Basically think that the upper portion, upper like third, and the lower 2/3 are separate movements. They function together, but you will find that individually they will move separately. So I am testing whether or not when I push up, there's any form of bounce. It will be very slight. This is very much a high palpation skill thing. And I am checking into the lower sacrum. Lower sacrum is the one that's a little bit more stiff for me. Is that more tender in there than there? Either change? No?
No.
It doesn't have to be tender, it's just sometimes information. So with the sacrum release, I'm going into the medial aspect just posterior to the tibia. I can go up on the top, or I can go around below. And I'm just encouraging a little bit of medial rotation. And so I'm actually pulling outwards with my fingers, just ever so slightly, and a little bit of traction. And I'm creating a little bit of a jostle back and forth, or shake back and forth, as I put pressure into the SI joint. It will start to unwind a little bit. I can then encourage it into deeper movements, internal, external rotation, to make sure I am feeling what I'm feeling. Sometimes if it doesn't want to move, I'll just go into the side of ASIS, and I'll just do a teeny bit of a bounce while doing that same pressure. This is something with low back pain I find presents very frequently as like I can just relieve that and suddenly their back's a little less tense. This is a little bit more pain sciencey, so we don't do any pain science in this program. That's a shame because there's a lot of good information on pain science, and there's not a lot of healthy conversation related to pain science and biomechanical models. It's more angry pain science people yelling at biomechanical model people for being dumb, which is really frustrating and not medically or scientifically helpful. Good, that's already moving better. So what I'm also doing here is I'm in L5 in the laminar groove, so the basically the erectors, right, between the transverse process and the spinous process. I am assessing some tension. What's the pressure in the back?
2.
Yeah. So I'm into the tissue resistance, and then I'm into the lateral head of the gastrocs, and I'm gently encouraging. You'll find with a lot of people who have tight hips or knee pain or tight low back that they sit in a little bit more external rotation through the legs. And so that movement through the fibular head, where the lateral head of the gastrocs lies, is sometimes restricted. And so if I hold on to L5 gently and stimulate it, and then create, what's the pressure in the gastroc there? 2.5, a little bit more.
Yeah.
So the other hand is between the